spinal cord stimulator device has been around for a fairly long period of time in terms of its technology. However, over the last really 5 years, we've made such great advances in battery technology that we're able to minimize these devices so that they can be implanted in patients to help with their pain. It's typically done to block pain because, as you know, most of us, unfortunately, at some point in our life will experience chronic back pain or neck pain. When patients have had surgery, such as PJ's case, and she's had some significant low back surgeries with a fair amount of hardware in there, and she was still having fairly debilitating pain. Because of that, rather than sending her for more surgical interventions or more fusions and things of that sort, we decided to try this device, which, when put into the correct areas, would be able to produce a different nerve signal that can block her pain nerve signals. And the great thing about this is, unlike injections, which can wear off from time to time, once the device is there, it can work all the time. And it's gotten to the point where we can do very elaborate programming, where patients would have different programs for different activities, different programs for different times of the day, so that if she's walking, she may activate a different set of stimulator parameters that can help more with her leg pain. And the major benefit of the device is that it is such a minimally invasive way to install the device. I had actually personally implanted PJ's device. It was an in and out surgery. It was done on an outpatient basis. It's not done under general anesthesia, so the patients tolerate it very well. They go home just an hour or two after the surgeries. And even patients we've seen patients who are much older, 89 years old, who can't undergo general anesthesia because of the concerns over it, but yet they're able to undergo this procedure that can bring them fairly significant pain relief. With the stimulator in place, instead of feeling pain all the time, when the device is on, she normally will feel less pain, and she could instead feel sort of this massaging sensation. Is that correct, PJ?
That's right.
Yeah.
I feel like a little tingly feeling, which massages it through, and it goes all the way down my legs from my lower back down, and it doesn't bother me at all then. And I usually use it when I go walking the 3.5 miles a day.
Yeah, and I know prior to this device being installed, she was having quite a bit of difficulty with even doing simple things like walking short distances.
Exactly.
So
I couldn't walk very far at all.
And I think the other major advantage of this, a treatment like this versus conventional surgery is that often when we have surgery, there's no trial of the surgery, right? We have surgery and then we pray to God that it turns out well. Whereas with this, with something like this, she actually underwent what's called a 1-week trial of the device, where there were no surgeries done. All we did was we took a very thin needle that went into the back, just like we typically would do with a back injection, but instead of putting medication through the needle, I had actually put this small cable through the needle into her back, and she went home with this for a week to try the device out. And then at the end of the week, she gets to tell me, yes, this worked well for me. I like to move forward with the permanent device. That way we'll know that her outcome is going to be favorable, as opposed to surgery where, it's fairly uncertain whether surgery can help pain or not. So I think that's the chief advantage of performing this procedure over that. And I think in PJ's case, she's done very well since then. Between, something like this and some of the other minimally invasive advanced procedures that we perform here, she tells me she's been able to lose a fair amount of weight, right?
Over 100 pounds.
Yeah. So, and again, our hopes in pain management is always to manage patients' pains, because unfortunately, at some point in our life, we may all deal with pain, but we want to do it with less invasive things so that we can improve her functional outcome, her ability to exercise and do all the things that she enjoys, without major surgeries. One of the things I always discuss with patients is when we look at managing pain properly, it's really not just, we don't rely on one thing. We rely on using multiple things. If we just relied on medications, for example, she would be on very high doses and probably would have significant long-term side effects that can really harm her in the future. And if we just did injections, when the injection wore off, her pain would be back. So instead, we utilize multiple modalities here so that we try to cover every single avenue of where her pain is coming from to really help give her the improvement that she needs.